Hello, everybody. This is Dave Sherwin with the Nairobi Health Show and Dr. John Burd. Dr. Burd, welcome to the show.
Thanks, Dave. Thanks for having me. It's really appreciate your trying to help me spread the good news.
Well, it's really important good news. I am happy to help share this. You have a long-term history in the arena of diabetes care and natural solutions, and it's a super important topic. And of course, it's something that touches all of us. You have family members close to you that
Yep.
have been negatively affected, and I think almost everybody does, right?
It's like 50% of the population around the world has either prediabetes or diabetes. And, there's two types of diabetes: type 1, which is an autoimmune disease where you need to take insulin shots, and type 2, which is really a lifestyle disease. You can thank the government, big pharma, the food industry, and the medical profession for keeping everybody obese, diabetic, hooked on multiple drugs, and still sick. It's really a pathetic situation, and I'm here to try and help it.
It's a great fight to take on, and you are one of those people that's leading the charge, and I appreciate that as a natural nutritional coach. And I'm gonna read your bio here, Dr. Burd, for those that don't know
Okay.
you. Dr. John Burd. And first of all, I better ask you how to pronounce Lycheeland. Am I saying it correctly as Lycheeland,
It's
or
like
is it
it's like insulin, but with the Lycheeland.
Lycheeland? Okay.
A lot of people have a hard time with it, so don't feel bad.
I wanted to get it right. Lycheeland.
Lycheeland, that's perfect.
Okay. Fantastic. Well, he is the former CEO of Dexcon, which is a $40 billion company. He now owns Lyceland Inc., a diabetes management company. He's also the #1 best-selling author of The Natural Solution to the Diabetes Epidemic, The Discovery of Lyceland. And where's that book available, Dr. Burd?
Amazon. It's either available at Amazon or you can email me and I will send you a PDF copy.
Well, fantastic.
It's like a conspiracy tale, as I just mentioned a second ago, a conspiracy between the government, big pharma, the food industry, and the medical profession to keep people sick and hooked on multiple drugs.
Tell us a little bit about the history of this. So you mentioned it's a lifestyle problem, which may be somewhat offensive to some people. We're so careful with how we talk to people, but I will tell you a personal story that happened literally 2 weeks ago. I was on a golf outing with some buddies, one of which has type 2 diabetes. And so he has to take care of this, right?
Yeah.
He has to give himself shots and whatnot. And during the course of the discussion about this, he looked at us and he said, guys, I got to tell you something. I know exactly what I got to do to stop having diabetes.
Yeah.
He goes, and I just can't do it. And I know that may seem stupid to you guys, but I want to keep eating what I eat and I don't want to exercise. And it was just kind of out of the blue, but he basically is currently more comfortable with handling the symptoms of diabetes and doing the medical care than changing lifestyle. And for those of you with absolutely perfect self-control, throw the first stone, right? We're all human. We're all weak. And so, Dr. Burd, I don't approach this so much as a judgmental. We're all part of a system. You kind of alluded to this. We're part of a system that makes it hard to be healthy. We really are.
Yeah, it's like we could thank our mom. When we were teething, she would dip her finger in some sugar or put some sugar on her finger and rub it across your gums, and you'd be all happy. He got hooked on sugar by at an early age, and you stay hooked on sugar thanks to the food processing industry and high fructose corn syrup, which is really the devil's work, and that's in everything. So it's really hard. It's hard to avoid carbs and avoid sugar, and really that's what you have to do if you want to, help your diabetes. So
if we go back, if we go back not that many decades, not that long ago in anthropological time, right? Before factory farming and before processed foods, how high do we estimate the incidence of type 2 diabetes to be?
Well, right now it's like over 20% of the population. It's like 20, well, it's more than that. It's like 20, I think there's like 25 million people or so in the United States. Worldwide, it's over hundreds of millions, and it's going nowhere but north. I mean, it's, basically in 1980, when the government came out with that stupid food pyramid, which recommended high carbohydrate, low fat diet, which is just totally upside down. They recommended that, and of course, everybody followed it. And if you do a chart of diabetes and obesity on the y-axis and date on the x-axis, starting in 2000 in 1980, it's just gone skyrocketing. It just goes up every year, it gets higher and higher, and the government keeps publishing the same stupid food pyramid year after year after year, in spite of so much data showing how bad that diet is for everyone.
It is mind-numbing, isn't it? I mean, oftentimes what is accepted as the status quo or the norm can be completely wrong. Very large groups of people can be wrong about things.
Yeah,
I mean,
it's like
history has
everything
shown us
you've learned is wrong. Yeah, that's true. Yeah,
that.
it's a real problem. So,
But
anyway,
do you have any idea what it was before factory farming and processed foods?
well, it was it's gone steadily up, but the population's gone up too. So I think, I can remember my first job was at the Ames division of Miles Laboratories, and they were the first company that came out with products for people with diabetes. And
Oh, wow.
the first test was a urine dipstick test for glucose. And normally your kidneys hold back glucose so that you can use it. And you have to get up to pretty high levels of glucose in your blood for glucose to spill into your urine. And then Ames came out with the first home testing meter where you could prick your finger and get a drop of blood and find out what your blood glucose was. And I can remember at every meeting of the corporation, there was always all this talk about our new diabetes products, because the management could see how it was a large and growing problem. So,
Unfortunately.
yeah.
And you've been in the industry ever since. I mean, you are a pioneer, really, in diabetes care.
Well, I wouldn't say that. Actually, when I was at Ames division, I didn't work on the glucose products.
Okay.
I only started in the 90s, actually, with my first company called LXN, and Lexan developed a home test for which gave you your average blood sugar over the previous couple of weeks. And that's really, when you have type 2 diabetes, taking a random glucose measurement, that doesn't tell you that much, because you don't know if you're going up or going down, or if you're staying the same. Whereas a average glucose test like fructosamine or hemoglobin A1C is the most popular one. That gives you a 2 or 3 month average. And we actually sell a home test kit for A1C, so people can do it at home. They don't have to go to their doctor and get a laboratory test. They can actually measure it at home, just like a glucose test, and it tells you your average blood sugar. And that tells you basically if your therapy is working or not working. So,
And frankly, in this age of biohacking, when there's so many tests that are available, people where people can bypass the system, the establishment, and go directly to a variety of really useful testing for themselves, right? The realm of biohacking is fascinating. It's fairly new science. But one of the things that I think is fascinating and frustrating is that we have some really great glucose monitoring systems now. And do I understand correctly that we still need a prescription from our doctor to be able to get one?
it's ridiculous. I'll tell you, the FDA and insurance companies are two of the biggest roadblocks to innovation. Like Dexcom got that product approved in 2005 or so, and it took them 3 or 4 or 5 years to get insurance reimbursement, but you still have to have a doctor's prescription. And I think that's the same case with, there's another continuous monitor now from Abbott called the Libre, and I think it also, though, still requires a doctor's prescription. It's like, well, if I want to test my blood sugar, why do I need to have a doctor's prescription? I just am curious what it is. I want to know what I eat, how it affects my blood sugar. That's really.
And there are thousands of experts like yourself who are saying the same thing, just shaking their heads like, this is one of the best biomarkers we could gather for people who are unhealthy, for people who want to improve their health, for biohackers that are perfectly fit. And why would our government create a roadblock to that when we have
Crazy, isn't
so
it?
many problems and so much stress on our health system? I
Yep.
don't get it.
Yeah, the company, the country spends, three or $400 billion a year on diabetes and its complications, and it kills more people than COVID-19 by a long shot. I mean, people are dying every 15 minutes. Someone dies from one of the complications of diabetes, and most people appreciate what a devastating disease it can be. It's terrible, the complications. And
Okay, well,
that's why I came up with Lycheeland. It's actually the formulation is the only product that targets the cause of insulin resistance and type 2 diabetes. And that cause is glucose toxicity. We need glucose for energy that we use every day, but it's a poison. We're poisoning ourselves with carbohydrates and glucose. And glucose is a chemically reactive molecule. It reacts with all the proteins in your body, in your eyes, and your nerve endings, and your kidneys, and your blood vessels, and causes all these complications. And when you take Lycheeland, it has a high amount of lysine, and that's an amino acid that's in all the proteins. And the glucose can now either react with your proteins or it can react with the lysine in Lycheeland. And when it reacts with the lysine, you form glycated lysine, which is a small molecule, and your kidneys excrete that. So it's like a sponge. It soaks up excess glucose. It's the only product that targets the cause and not just the symptom. So I'm so happy that I dreamed up the formula. And we have 7 patents now that cover the formulation too. So that's
and
good.
this is a little bit of a tangent, but do I understand correctly that lysine has also been proven to directly improve eyesight in many people that take it?
I am not sure about that, but I know that, if you have diabetes, when it gets a lot of places it first gets diagnosed is at your ophthalmologist, where he looks at your retina. And if your retina has problems with bleeding on your retina, that's due to glycated proteins. Your retinas are not working right because they're getting glycated. So Lycheeland can help with that problem. So
Okay. And I want to back up because I want to finish. I mean, your punchline is obviously these patents that you have, and you've got a product that's amazing, and I do want to hear about it. But I want to back up just a little bit and kind of go on a methodical 3-step phase. So I want to, first of all, you've already mentioned diet and the problems with the diet that a lot of people have adopted. And for people listening who don't have diabetes or maybe not pre-diabetic, and they never want to become that way, what are your top nutritional recommendations for people to adhere to?
Well, at the top of the list is avoid carbohydrates. That's really hard to do. If you go to the grocery store, it's like all carbohydrates. You know what I mean? And it's like potatoes, pasta, vegetables. They all have carbohydrates in them. And if the only foods really that don't have carbohydrates are meat, beef, chicken, pork, fish, shrimp. They don't have any. And eggs is also a fabulous food. So I love eggs too. So I eat as much egg as I possibly can, but I still catch myself. My wife will buy these carbohydrate snacks for some reason. I don't know if she's trying to poison me, but with carbohydrates. That's the best thing you can do. Avoid carbohydrates and lower your caloric intake. I mean, if you can get your carbs down and your calories down, you're going to have the best health. I mean, the Romans knew it, that food was the best medicine. And there's a famous quote from Edison about how, food is the best medicine. That's the best thing you can do for your health, is to watch what you eat. That's tough.
Are you a keto fan or a Mediterranean diet fan, or is there a certain named protocol that you align well with?
I'm a total keto fan. I mean,
Okay.
ketogenic diets are high protein, high fat diets that avoid carbohydrates. When you avoid carbohydrates, your body no longer has glucose for energy, so it burns fat. And that's why
Yeah.
the keto, Dr. Atkins diet and all that are really healthy diets. And we also now at Lycheeland, we have capsules, tablets, once a day powder, liquid, and we just launched a weight loss shake that contains Lycheeland. So you can have a shake for breakfast or lunch or dinner, and it's low calorie and no carbs essentially. So that's
Yeah, and I want to dive into that a little bit. You've mentioned avoid carbs several times now on the podcast, and of course, it's impossible to have zero carbs, and we probably don't want zero carbs because they're also important for hormone regulation. And there is a positive to some carbs. Is there a certain amount of grams per day, or percentage, or portioning that you're advising people to do?
no, I don't know. I mean, that stupid food pyramid has like 60% carbohydrates. I can tell you that's wacky. So
Yeah,
I'd say, if you can,
yeah,
if that was 60 grams a day, let's say, then I'd say if you can get it
right.
down to 5 grams a day or 10, as low as you
Oh,
can get
really?
it. Yeah.
That pretty much cuts out all fruits and vegetables, though, don't you think?
Yeah, most of them, although there's this thing called the glycemic index, which I'm sure you're familiar with.
I am.
And it's like you can look at on Google glycemic index and it will tell you which vegetables have the best glycemic index, which is
Yeah.
a low glycemic index. And, you can eat, there's a few vegetables that have a really great, I don't remember them right off the top of my head, but spinach I know has really got a low glycemic index, and
Right.
other things. But yeah, fruits and vegetables for the most part have sugar and carbohydrates in them. So, but as we keep saying, we're like a broken record in a way. It's like really hard to get off of carbohydrates. But you just got to do the best you can.
Okay, so in your world and with these solutions you come with, are they kind of designed for this very point you're making, that it's pretty hard. It's pretty hard to be in our modern society and never eat carbs. They're everywhere, every restaurant, every party that we go to,
It's
right? The
interesting.
most convenient foods.
You asked before about what was it like before the modern diet, and you get a clue
Yeah,
from that looking at the Eskimos. The Eskimos basically eat fat and meat. They don't have wheat and corn and all that stuff.
right.
And they had no diabetes before they headed south or before McDonald's headed north. And now that they have the Western
Interesting.
diet, they have diabetes as bad or worse than anybody. But that's a clue that diet is the best medicine. So, and they just
That's a
eat,
big clue.
yeah, they eat all that blubber. I mean, that's a lot of fat to eat. And also, fat is tasty. Butter, add butter to something, it tastes a lot better.
You just can't add it to your toast.
Yeah. Don't add margarine. That's bad for you. But
Oh,
butter,
absolutely.
butter is good for you.
Butter's good for you. The problem is I like it on like Dave's Killer Bread, and you're telling me I can't have Dave's Killer Bread anymore.
Well, I'm not telling you what you can and can't do. I'm just making suggestions as to what you might want to consider doing. So
For sure, yeah, lower carbs. But again, we live in the real world. Your company is addressing that, and so are we saying here that a person can? Of course, we're not encouraging anyone to eat unhealthily, but again, if they're eating mostly healthy, better than the standard American diet, you have these products, and are they designed to negate the effects of carbs that people are eating, or do they have to cut out carbs and take the product to get these benefits?
no, it actually they work with your diet. So if you uh, use Lycheeland, it basically helps eliminate some of those carbohydrates that you're putting into your diet. So it works with your diet. So no matter what your diet is, Lycheeland can help because, as I said, it targets insulin resistance, and that is the cause of diabetes. In fact, I'm putting in the chat box a video that I made that talks about the cause of insulin resistance and how Lycheeland works to help with that.
Well, perfect. We will put that with the show notes. And for those of you listening,
Oh, great.
we put show notes, quotables, so the best quotes and tips and links to this product, everything at blog.dirobi.com. Or if you just go to our website, dirobi.com, and click on podcast, then search for, you could probably just use the last name Burd, B-U-R-D. And the content we create from this will come up. And so any resource Dr. Burd provides me, and all that he's already provided me, we'll make sure you can access all of it. And so you've mentioned a little bit about your product, but let's get a little more into it. You have a shake. What else is there? What's the original? Is the original capsules?
No, the original one, when I first went out in 2017, when I came up with the formulation, there's a bunch of different contract manufacturers in the United States that make supplements. So I contacted a bunch of them and I found one to make me tablets. And the first tablets, you basically had to take 3 tablets a day, but they were big tablets. I mean, they were like that big. So,
Yeah, I get it.
people complained immediately about the horse pill. So we came up with a
Yeah.
chewable tablet, but you had to take 6 a day. So people complained, one, about the taste of the chewable, and 2, I don't want to take 6. So we came up with capsules, which a lot of people also complain about artificial sweeteners that you have to add to things like chewable
Ah,
tablets.
all right.
And so that's why the capsule is a good idea, but you still have to take 6 a day, because basically if you take 6 capsules or tablets a day, you get 3 grams of lysine into your bloodstream. And we've optimized the amount of lysine, zinc, and vitamin C in the product so that they can, so that it gives you the most benefit with the least side effect, unlike drugs, which have so many terrible side effects. But yeah, that's so we have capsules. We started out with the original big tablet. Then we went to chewable tablets and a better tasting chewable tablet, so that we now have chewable tablets, capsules, powder, once a day powder. You just put a little scoop of powder in a cup of water and it tastes like salty lemonade.
Okay.
And now we have our new weight loss shakes, which is chocolate and vanilla. And most people like the taste of them. They're really tasty. And it can eliminate 1 meal a day. And there's a lot of publications that show that people that use shakes for weight loss are successful in weight loss. So now we have obesity and diabetes treatment all in one shake. Makes a good story. We just got to let people know about it.
Yeah, and I'm on periodicals. I'm on one paid subscription I really enjoy called examine.com that examines all the latest research and meta studies.
Yeah.
And one of their big publications last month was on this very topic of what type of success do people have who use a shake as a replacement for a meal, and the results are very positive. So yeah, I'm familiar with that research, and it looks like for many people that's a great strategy, is actually to just replace one meal with a shake of the kind that you're selling. So that's great.
Yeah, that's interesting, actually, relative to that. Again, the FDA sent us a warning letter in September, 6 months ago, that we were making drug claims. And the language on our bottle is basically, it's nutritional support for people with diabetes and prediabetes. Well, our FDA counsel gave me that language. So now the FDA is saying, oh, you can't say that. So we're having to change our labeling because we can't claim it helps people with diabetes, which it does. I mean, it's like you can't say that because the FDA and the FCC say you can't say it. Okay, so we'll change it. I mean, all I care about is a way of getting the product into the hands of people that can use it. And, so we're changing the labeling so it'll say nutritional support to help maintain healthy blood glucose, A1C, and insulin function. And we just had a fabulous study published on prediabetes that showed that the control group had the usual problems, but the people taking the Lycheeland, they reversed diabetes. So their A1C improved, and they did not go on that path from prediabetes to type 2 diabetes. So we've got substantial clinical proof that the product works. If you Google Lycheeland, there's a guy that did a review 3 or 4 years ago and said, is this real or snake oil? And of course, everybody sees snake oil and they immediately think, oh, it's snake oil, because historically supplements have had a bad name because guys like me say it'll do this or that, but they don't have any proof. Well, Lycheeland is built on a solid scientific foundation, and we have clinical proof that it really works. So,
have you considered getting FDA approval? I know it's a beast, but have you looked into it?
I can't afford it. I'm going to the poorhouse right now as it is, keeping the company going, because I'm basically self-funding it from what's left over of my Dexcom days.
Yeah.
And, to do a drug submission, you're looking at $20 billion and 10 or 15 years to get it through the FDA. And when you get it through, it basically says that you have to write a prescription for lysine, zinc, and vitamin C. And why not just go to the store and buy it? Well, one reason to do that not do that right now is because we've optimized the amounts to give the maximum benefit and most safety.
But we're talking about two different things. You don't have to get it approved as a drug. I've got a friend who has a protein powder that he had clinical evidence on, and he went to the FDA to not have it approved as a drug, but to have his statements regarding his product approved so that he could say this has been evaluated by the FDA and this is a clinically graded protein powder that does XYZ.
I'll make you a bet. I'll bet somewhere on his bottle, he's got a little black box that says this product has not been evaluated by the FDA and is not intended to diagnose, treat, cure, or prevent any disease. So we also sent our labeling to the FDA.
Oh, okay.
And 4 or 5 years ago, and they didn't really give much of a response.
Yeah.
But once we get through this hassle we've been going through for 6 months with these guys, and they're just so unresponsive. They don't care. The day we got that warning letter, we were immediately kicked off of Amazon and Walmart.com. So our revenues from September until now have been under 50% of what they should be, because that's where a lot of our product was sold.
It's terrible. It's terrible. And I avoid politics somewhat on this show, but when it comes to the topic of health, I don't mind being a little bit outspoken in that we live in what's supposed to be a representative government, where our government are supposed to be we used to call them public servants, people that served us, and we pay the taxes that pay their bills. And the point is, yes, of course, to protect us from snake oil sales, and we totally get that. But they've gone completely haywire to where they are now actually enforcing things that make people unhealthy, preventing things that are healthy from coming to market, and everything has gone completely backwards.
Well, and doctors love to write prescriptions. You'll find a few types of doctors, naturopaths and some homeopaths and osteopaths that do like to use supplements because they work. And if you look at some of the drugs that get approved, it's like their side effects are horrific. There's an injectable diabetes treatment. I can't think of the name of it, which I wouldn't say anyway. But basically, one of the published side effects is genital gangrene. My God, what a side effect! You call that a side effect? I call that a
that sounds
effect,
great.
not a side effect. So, but nonetheless, they're still selling it.
Yeah.
I mean, it doesn't happen to 50% of the people that take it, but it's still a horrific side effect.
Well, tell us where people learn more about your product.
Well, basically, they can email me or call me. And shall I put my email address in the chat box too?
Sure.
Burd,
although we don't want you to start getting spammed, because if we make that public on our website, and we have a lot of visitors every month,
I get
probably better to do your webs. Don't you have can they buy it at a website?
2873. Yeah, it's still available on our website, and I'll put our website in there.
Let's do that. That'd be better.
www.Lycheeland.
Lycheeland.com. For everyone listening, that is Lysulin, correct?
Yeah.
It's just Lycheeland.com.
Lycheeland.com. Yep.
And it's a patented product available in various versions. And the whole point of this show, Dr. Burd, is to help people be more healthy, to avoid future problems, which, of course, this is what your whole pitch is about, is helping people either deal with pre-diabetic symptoms or avoid potential upcoming problems that they may be headed to and not even realize it. Now, that being said, closing thoughts and suggestions for people. You've already given us a lot of great ideas and insight into some of the trauma that currently can be inflicted on small businesses in the health space, like yours and mine, and also some dietary advice, stats on diabetes and how it's going up, and I think everyone is aware of that. And so, obviously, your product is your solution for this. What other tips and ideas do you have for people today to avoid some of the health catastrophes many people are running into?
Well, my advice, anybody that has type 2 diabetes, if your doctor starts talking about giving you insulin shots, do everything you can to not let that happen, because turns you into a junkie. You'll need more and more insulin, and it will work less and less because of insulin resistance. I urge everybody, before they start insulin, try Lycheeland. It works for 60 to 70% of people who use it will see the benefit. It takes a month. It doesn't happen immediately. It's not insulin. It doesn't immediately lower your blood sugar. It has to build up in your blood. So, but give it a month, and 70% will see their A1C improve. And a lot of people can get off of other medications. I've had a lot of people get off. Metformin is the most popular one. And a lot of people have gotten off of that. A lot of people don't like to take it. It's a relatively side effect free drug, but still a lot of people have gastric problems with it and stuff. So that's my best advice is, avoid insulin. I also put a second website on the chat box, which is another company I started, again, because of diabetes. It's called www.thewonderspray.com. And we just actually relabeled it. It's now called Dr. Bird's Wonder Spray Skin Rescue. And this is basically the active ingredient is what your white blood cells use to kill all germs. It kills bacteria, virus, yeast, mold, and fungus. It's on the APA list for disinfectants for COVID-19. And I can't say this in public, but I can tell you that it's actually the cure for the common cold. If you have a sore throat, you just spray it in your throat, give it 5 or 10 shots in your throat will immediately feel better. It doesn't take 20 minutes or days to work. It'll immediately feel better, and it will kill whatever is trying to make you sick, whether it's a bacteria or a virus. It even improves allergy symptoms by
Interesting.
another mechanism. It's an incredible product. And again, trying to get the word out is so hard because we have to dance around what we can say in public. But
yeah, and
I got interested in it because of wound healing. The active ingredient, which is HOCl, is actually FDA cleared for healing of wounds, and people with diabetes get these horrific wounds on their lower extremities that don't heal right, and this will help them heal. And they don't heal because they have germs growing in the wound bed, and this will kill all those germs. And also
interesting.
Yeah, it's a fabulous product.
Now, there are healthy germs on our skin, and I assume and obviously you're aware of that, but people can use it and there's no ill effect on their healthy skin.
Nope, it was voted a #1 new skincare product by Women's Fitness magazine a year or two ago.
Oh, is that right?
Yeah, that's great. It's like if you have acne or burning or itching or sunburn, bug bites, poison ivy, all that stuff, it will help with that. It's like, the good news is it's good for so many things. The bad news is it's good for so many things. Like nobody can
right.
talk about snake oil. I mean, it's like unbelievable all the things that it's good for. So
well, we should do a trade like kids playing with cards or marbles or whatever. I'm going to give you $100 gift card for being on the Nairobi Health Show, and I'd love to try out some of your products as well. So
you don't have to give me anything, Dave. Just send me your mailing address, and I'll shoot you a bunch of product to try and pass out to everyone that can use it. And really, everybody should have. Well, I never go anywhere without Wonder Spray, and if you're traveling, what can be worse than getting to your destination and getting a cold or flu? Nothing. That's terrible. So I never go.
This really helps.
My Wonder Spray. Yeah.
Wow. Interesting.
Yeah.
Well, fantastic. I'll send you my info, but I will send you that $100 gift card to Nairobi.com because I'd love to have you try our products as well. We have a wonderful line of supplements. And also, I'm very interested in Lycheeland. I don't know if you do wholesale agreements, but it could be a great product on our store. I'd have to talk to my team and see if,
Please. We do. I'd love to have you distribute the product. That would be fabulous if we can get it on your website. Just let me know what you need to do. We do have wholesale pricing for.
Okay.
We do want to sell the product. So that's great, Dave.
Fantastic. Well, I will talk to you offline about that. And for those of you listening, this is Dave Sherwin wishing you health and success.
Thanks again.
Thank you, Dr. Burd. It was a great interview, and we will follow up. And to those of you listening, thanks for listening to the show. And again, give us a few weeks, but we'll publish all the information we just talked about at dirobi.com, dirobi.com, and just click on podcast, and you'll be able to find everything that we talked about and get more information.
That's great.